You know the subtle rhythms and patterns of your own body better than anyone else. This familiarity makes you the most important observer in your own health. To understand what we're looking for, we have to look at the biology. Breast cancer starts when the cells lining the milk-carrying tubes, or the tiny sacs where milk is made, stop following their normal biological instructions. In a healthy state, these cells are perfectly aligned. But if those instructions fail, the cells begin dividing rapidly and out of turn. They pile up on top of one another, eventually forming a physical clump or mass that blocks the path. This is what we refer to as a tumor. When we see this as a physical process, cells simply losing their way and clumping together, it becomes a challenge we can measure. By understanding the mechanical why behind the growth, we can start to look at how to stop it. Our first step is identifying the different factors that can tilt the scales toward this kind of cell growth. Some factors are simply part of who we are. Being female, the natural process of aging, and having a family history of the disease all play a role in our baseline risk. In some cases, that family history is tied to specific inherited traits, like the BRCA1 or BRCA2 genes. These are essentially tiny errors in our internal blueprints that make it harder for the body to keep cell growth in check. But we also have factors we can influence ourselves. Maintaining a healthy weight, being mindful of alcohol intake, and managing hormone-based medications can help tilt those scales back in a healthier direction. Taking charge of these lifestyle choices is a way of creating an internal environment where it is much harder for rogue cells to take root. Staying healthy isn't about waiting for a problem to appear. It's about a routine of checking in with your body to know what normal feels like for you. A monthly self-check is the simplest way to keep track. It's a quiet moment to ensure you're familiar with your own physical baseline. Clinical exams with a doctor add another layer of certainty. They are trained to use a specific type of touch to feel for very subtle changes that might be difficult to notice on your own. The most detailed look comes from technology. Once you hit the milestone at age 40, a regular mammogram, a specialized X-ray of the breast, becomes a core part of this routine. This multi-layered approach is designed to catch changes while they are still tiny. The earlier a change is found, the simpler and more effective the medical response can be. Beyond routine checks, there are specific physical changes that should always prompt a conversation with a doctor. The most common sign is a new lump. These are often painless and can appear in the breast itself or even high up toward the underarm. You can also look for visual changes in the mirror. Watch for one side looking or hanging differently than the other, or any areas where the skin seems to pull inward or dimple. Look at this comparison. On the left is the thick, pitted texture of an orange peel. The diagram on the right shows how when the internal fluid draining channels in the breast become blocked, the skin above can take on that same pitted appearance. Changes around the nipple are also significant. This includes the nipple pulling inward or any unexplained bloody discharge. Because so many of these signs are things you can see or feel yourself, you have a direct and powerful role in your own care. If you or your doctor find a concern, the next step is a standard 3-part checkup to get a clear picture of what's happening. It begins with mapping the area. Doctors use ultrasound or MRI scans, like the ones shown here on the monitors behind the clinician, to see the exact shape and density of the tissue below the surface. To be certain, they take a tiny sample of the area for a closer look. This microscopic view shows the actual cells involved. In this case, the dark purple clusters confirm that the cells have indeed started to grow out of turn. Following this methodical path removes the guesswork. It ensures your medical team understands the exact nature of the cells before deciding how to move forward. Once the cells are identified, doctors create a plan based on the size of the growth and whether it has moved into any nearby fluid channels. Often, the first step is physical removal. This might mean removing just the localized lump, or in some cases, removing all of the affected breast tissue to ensure the area is clear. After surgery, other treatments like radiation or chemotherapy can be used. Think of these as a way to sweep the body and stop any remaining fast-growing cells from causing future issues. We also have very precise options called targeted therapies. Some rogue cells have specific markers on their surface. We can use medications that act by connecting only to those specific markers, which then signals the cell to stop growing. Other treatments work by cutting off the cell's fuel. Many tumors use the body's natural hormones to grow, but these medications block those hormones from reaching the cell. The hormones simply bounce off, and without that fuel, the growth stalls. Breast cancer is a challenge we know how to meet with clear, physical evidence and a variety of proven paths. By knowing your own body and noticing the signs, you give yourself a significant head start on the road to staying healthy.
Thanks for watching MBBS Study. Keep learning daily. Like, comment, subscribe today. See you doctors on the way.